You don't have to eat like slaves anymore because we're not slaves.
If you cannot control what you eat, then you cannot control what you feel.
Eat your largest meals in the middle of the day, not the end of the day.
What part the homeostasis plays, you're on your way to healing yourself. The homeostasis is the internal environment where your body is at its ultimate functionality for healing. Just keep in mind that everything that is happening to you is happening for you.
Hello, good morning, good morning. Thank you all so much for joining us here in the Mind of Nature. I am Carolyn, your co-host, and you are here in the Mind of Nature with Dr. Zarif, the nutritionist. And today's topic is the hidden pandemic. So for everyone that's joining us, thank you so much for joining us here today. We are streaming pre-recorded, actually. We are streaming a pre-recorded stream on Facebook and on YouTube. So please just understand that Dr. Zarif and I will be in the comments and or in the chat and going and answering any questions that you may have. All right. So Dr. Zarif, go ahead and join me up here on the stage so we can get it started.
Did you get enough rest last night? Did you? Because
I did.
You got this, right?
Absolutely. Yeah.
Absolutely. Okay. Good. That's the main thing, because you are wonderful and you're dynamic, and as we continue to do this, it gets a little smoother and smoother. So don't worry about a thing. Keep on doing your thing, Carolyn, because you're definitely bringing to us that edge we need, that constant support from you with that great spirit you have. So I'm just so wonderful and enamored by your ability to just call in a few seconds. Let's go ahead and get it done. So thank you so much for that. I appreciate it.
Thank you. I appreciate that.
Well, everybody, today we're talking about this subject is, I mean, this got to be on my list of favorite subjects, and that is to talk about the pandemic that is hidden, the things that we're doing right now that we seem to neglect just because they've been around a long time. Now, these numbers are changing as far as, we are doing things better now. I'm really, really happy to report that. However, we are continually losing at a massive rate. These our parts of our family, our loved ones. We have different people that we are co-workers and so forth. This is really, really important that we pay attention to this. Now, I mean, Carol, what do you think about this? My whole idea for doing this entire chat on what we're about to talk about now is because I feel that we're neglecting to take care of ourselves when we should be really taking care of ourselves proactively. And we don't wait. We wait until something happens and we're reactively then. And we've been talking about this over and over, and it appears that people take it for granted. They're just like, don't worry about me. I'll continue to eat whatever I want to eat. I go to bed whenever I want to go to bed. I do it or I do not do it if I don't want to do it. That kind of attitude. And I think from that attitude, what happens is that it results in the kind of diseases and infections and illnesses that we face on a daily basis. So what do you think about that?
Well, I think that the vid is what I call it, the past pandemic that we had that scared everyone. I think that shook everyone up, and it helped to make people realize that taking care of yourself should be a lot higher on the list than it had been before, because a lot of people, when the vid hit, it was like, if you had an existing disease, you were targeted. You know what I mean? And some people didn't realize that they were even living with that until something else came about, the vid, and that made them think about, oh, I have, high blood pressure, or I have whatever that may be, that disease may be, to cause them to be a target for the vid. So that's my thought on it. I think that it's really it's something that we definitely need to have on the list, on higher on the list of things to do and to prioritize.
What would you say to a person that, for instance, if you let's take a person that has prostate problems, and this is someone that's close to you. They know that they have this prostate problem. It can even be prostate cancer, and they can only do so much about it. What are some of the things you're saying to that guy?
Hmm. Well, one is I'm here with you, you know, um, and make sure that the communication is open, asking what you can do to help. Because being a woman, I don't have a prostate. I don't know what that process is like. You know, don't know what the discomforts are that he may be going through. So just having a open communication and asking what you can do to help, and even doing your own research to find out what he may be going through and what you can do to help. So
That's
that's one.
key. I think I'm so glad that you said that, because ladies that are listening to this, we have many um, your companions and your friends and other men after the age of 40 years old. It's time to make sure that they have a steady exams. That is at least once a year to check the prostate, because many guys wait too late, and then we lose these persons because we don't act on it. Now, some people just simply have benign prostatic hyperplasia, which is a enlarged, naturally enlarged. This is something that happens just because you have a male reproductive system, and a part of that as you age is an enlarged prostate. However, there are other situations that may be a part of the induction of cancer. And this is something that is more existential than the enlarged prostate. So, understanding that, it's really, really wise to go and get more information. Doctors that work with men or prostate, doctors that are urologists, are male and female. You can ask those questions. That is, if it is necessary, if it seems like there's nothing, no action taken on the behalf of that individual. Some individuals just say, for instance, if they find out that they have cancer of the prostate, for instance, and the doctor, surgeon, whomever they're working with, the urologist may say, you have you diagnosed with cancer. Therefore, there's going to be radiation treatment that we suggest, and we also suggest chemo. Now, that doctor can only suggest that to you. They can't make you take it. But since it isn't something that can be forced on a person, what many guys opt to do is to not take chemo. They also opt not to take radiation. And if they don't do this, what happens? The possibility of the spread of that cancer will occur. So instead of it just being benign, it is now cancer, it spreads. okay, malignant, and it spreads throughout the body. And once that spreads, then that's when the life is threatened. The total life of that person is threatened. So I want people to hear me when I say this, is that when you are diagnosed with cancer, it is not the end of life. It just means that you have to make other choices in order to maintain as high quality of life possible. That's what some people do anyway. It's like, I'm going to do whatever it takes for me to have the optimum experience, the optimal level. And I know I do that. I know that, Care, I know you do the same thing. And
Yes.
we have friends and families that do the same thing. It's about right here, right now. But when
Right.
we're dealing with individuals that says like, no, I'm not doing that because I heard this and I heard that, I would say, first of all, take a deep breath, relax. Don't allow yourself to get tripped up in a lot of things you've heard. The good news is that the apparatus, the different machines that are in hospitals now, are some of the latest in technology. The test has changed quite a bit over the years. And now some of the things that you've heard may be superannuated, meaning that it's out of, it may be old news, is antiquated. So
Right.
update your knowledge
Mhm.
about what you're looking at. Well, regardless what kind of cancer it is, regardless of what kind of illness it is, check it out for yourself. This is what's really, really important. And as you check it out for yourself, you'll find that in most cases, you're like, oh, I thought somebody told me you took the fingers and somebody told me that all of this old information. Now,
Mhm.
some things doctors still use, and I'm not saying that what they use isn't effective, but nevertheless, technology changes. If you look at technology every 6 months, you will say, whoa, wait a minute, that isn't in style anymore, or something better. Well, that's what we want to do. We want to find out better ways to take care of ourselves. So that felt good.
Yes,
Um,
absolutely.
Yeah, it's really important because no one wants to lose their loved ones. No one wants to lose somebody that has been with you and for you and supporting you and loving you and going through your life with you and enjoying it and having children together and so forth. And then the person decides that, you know what, I'm not getting chemo and I'm not getting radiation because I heard that all you do, you can take this herb or you can take this pill, or I have this doctor that's up in the hills and he said that he can rescue me from this and he can cure me from that and all that. These are the things that we're still doing. And there has been people that have lost their lives because they did not go a little deeper and ask the doctor certain questions. They did not go a little deeper and get a second opinion. They did not go a little deeper and find out exactly what they could do as an alternative. So these are the kinds of things that we need to do in order to better ourselves when it comes to our personal health.
Absolutely. Absolutely. Great message, Dr. Zari.
Thank you so much. We're going to go ahead. You ready, Carol? We're going to put on our seatbelts and let's get it going. The hidden pandemic. Well, with the hidden pandemic, this is something that's really important because, as I said, when a new pandemic comes about, a virus or something that people are doing and it's new, it doesn't erase the other things. Like when fentanyl is real powerful drug that people are reportedly dying from now, and at large numbers, the addiction rate is huge. But there are other new drugs that are out that are also very dangerous. And this does not mean that the drugs that were dangerous before the introduction of these new drugs aren't dangerous anymore. So the idea is to just not use them at all, because they are dangerous and your life is threatened every time you use them. The hidden pandemic, that well, people are surrendering to existential illnesses. This means that those illnesses that we can't do anything about, what happens is people give up on life. Even if there is a situation where you have problems with your pancreas, your kidneys, your liver, your spleen, whatever the problem is, that is not the end of life. That may be the beginning of a new way to live, but it's not the end of life. And that's the message that I want to send to you clearly, because this will make the difference in the way that you experience life. Don't give up. Don't surrender. Continue to make choices that's going to add to your wonderful experience in living from moment to moment. Now, despite the familiarity of any disease, it is still a disease. Death is a constant that occurs to the extent of life expectancy, disease, accidents, war, crime, congenital and biological deformities, and premature fatalities. So when we talk about a disease, just because it's nothing you can do about it, it's already maybe in your system, and it's only is limited. There are limited things that you can do. Whatever those things are, you want to be about that. You want to be about if it takes a little more movement, especially when you look at the opportunity to eat healthier, and you can actually supply yourself with healthier foods. This is something that you should be moving on, getting the adequate rest, to get the adequate sleep, and to be in a low stress environment, low to no stress environment. Super important. Laughing, sharing, singing together, making love, sharing time with the children, visiting, accepting other guests visiting you, whatever it is to bring that smile on your face that is healthy and constructive. These are some of the things that will help you to enjoy the rest of your life. Now, there's never, ever a convenient time for you to get sick. We said that over and over. There's never a convenient time for you to get sick. But there is the time, and the time is now to do something about those diseases that are existential. The very important takeaway from this, as you'll see, will be for you to make the best out of what you're dealt. Whatever you're dealt right now, I want you to stop all of the anxiety, stop all of the fear. Take your time in learning more about how your body works and what are the things that you can do in order to make your body healthier. In an era of shifting global agendas and expanded emphasis on non-communicable diseases and injuries, along with communicable diseases, sound evidence on trends by cause at the national level is essential. We need to have ways that we can measure or quantify these non-communicable diseases and injuries, and we do. The global burden of disease, injuries, and risk factor study, which is simply called the GBD, provides a systematic scientific assessment of published, publicly available, and contributed data on incidence, prevalence, and mortality for a mutually exclusive and collectively exhaustive list of diseases and injuries. So we keep a report or published studies, the factors that we find out, the risk factors that we find out when we're studying this information. And we do know that people are still finding out about these diseases. The problem that we have when they find out about the diseases is that we continue the same behavior. So that in itself is a pandemic, because the numbers that we're dying, the rate that we're dying, that rate, the number, the people that are dying from these, the different cultures that are caught up in eating too much sugar, too much fat, too much sodium. All of these are some of the things that we need to change. People dumping all the salt on the food, or eating every day at a restaurant, eating the foods that we talked about just a week ago that are not healthy for you, that are quite dangerous, and not to spook you or to scare you, but is to make us aware so we'll make better selections, better decisions. Now, some of the methods that I was just speaking about as far as how we quantify these diseases, start off with the global burden of disease, which is the GBD. This is this estimates the incidence, the prevalence, the mortality, and the years of life lost. And you'll see that abbreviated as YLLS. The years lived with a disability, which is the YLDS, and the disability adjusted life years, and that comes in DALYS. So when you hear me say these particular abbreviations, that's what they stand for. Now, the disability adjusted life years, due to 369 diseases and injuries, and two sexes, and for 204 countries and territories. All of these different types of estimates, we're going beyond just the United States. We're talking about globally, because people are dying all over the world, especially when those countries that do as America does. So whatever America does, they do it right behind them, feeling that America is doing the latest things that are trending are more important, and it helps them to feel that they are doing things according to the latest thing that is happening on the planet. Now, input data were extracted from census, and the census, everybody is a part of that. That's a part of counting to calculate the amount of people or the population that we have. And a lot of that is separated by culture, by our gender. It might be age and so forth. Okay. But the cause-specific death rates and the cause fractions were calculated using the cause of death ensemble model, and some other processes that will help us to understand and to calculate that part of the GBD population, the fertility and the mortality estimates. Now, when we look at, let's look at this. I'm going to enlarge this here. Now, when we look at the life expectancy, we're looking at 73.4 years. Although women do live about 5, maybe even in some cases 5 to 7 years longer than their companions, or longer than males. But 73.4 years was the average life expectancy at birth globally in just a couple of years ago, in just 2019. Now, the life expectancy and healthy life expectancy is a very important measurement also, is called the GHE. And this is wonderful because there is a calculation for life expectancy and healthy life expectancy. If you are a person that is just living your life and without any special additives, such as, your exercise, such as, other healthy things, making sure you get enough rest, being in a low to no, stress. I'm looking for that word, that low to no stress environment is really important. That we get an idea of if you are living healthfully, how much longer do you live compared to those people that are just average, and they're not doing all of these extras. How long do they live? So this is what we see here, the 73.4 years. The 8.9 million deaths are attributed to ischemic heart disease. The world's leading cause of death in 2019 was ischemic heart disease. Now, this ischemia is something that doesn't give you a lot of cues. It doesn't give you these warning. You're not forewarned that this can get worse. So many people walk around with it. How do you find out about it? You may be asking. Well, the way that you find out about it is that you go and you set up, you make a call, and you set up an appointment and get your heart checked, get your vitals taken, have an annual. If you haven't started with your annuals as yet, begin those now, because you may just save your life. These are ischemic heart disease is a part of the leading causes of death, and we want to stop that as soon as possible. And it starts with you making sure that you have an appointment, making sure that you do get examinations, making sure you follow up on those examinations. Don't sit at home and talk about, I don't have enough money. If you don't have insurance, find out what are some of the sources that you can get free insurance. And there are some that I'm thinking about now. I believe the name of this, one of it, of course, older people, you can get, there's Medicaid for people that may not have enough money to buy the insurance that's provided by the government. And then there's Medicare, that is also a part of your retirement package. And usually that is a really wonderful way to get started. And then there are different other, United Health, and you have some other California, it was California Living or something of the nature, but look deeper into it. There's many of them, but those are what come to mind right now. Move on it and do exactly what you can do. Do all that you can do to change where you are, okay? And when I say change where you are, change what you're thinking, how you're thinking about that, okay? Because you want to think about the way to live your life fully. Now, the causes of death and disability can be grouped into 3 large categories. One is communicable. This is for infectious diseases along with maternal, perinatal, and nutritional conditions. Now, the non-communicable diseases are some of the chronic diseases, and most of the chronic diseases are non-communicable, meaning other people can't catch it because you have it. People don't catch cancer, or people, although they may having the flu is definitely communicable. Where there are other things that if it's maternal or prenatal or a nutritional condition, these or other infectious diseases, those are the ones that can spread. Now, monitoring the yearly number of deaths help to address their causes and adapt health systems to react effectively, triggering responses of the multiple sectors. So from the transportation and addressing the road traffic accidents, to the food and agricultural in tackling the rise in diabetes prevalence, and mental health support in the early detection of mental disease conditions. So you see, when it comes to monitoring the number of deaths, helps to address their causes and adapt health systems to react effectively. Now, understanding the reasons why people die can help comprehend the ways that people live to improve health services and reduce their preventable deaths. And many lives are preventable in our country, and responding effectively to changing the epidemiology or epidemiological circumstances. This is very, very important that we take on the responsibility to find out more information about ourselves, find out how your body works, find out what you can do if you do face that situation, and make a move on it. Be proactive. Don't wait until it's at its worst and then you ask for help. Okay. Now, here are just some of the things. Before we go over this, I'm going to bring back here. I'm going to just stop just for a minute. Let's bring Carolyn. Why don't you come on up, and before we go into these 10 global causes of death, and want you to just go ahead and do your thing.
Absolutely. Thank you to everyone that's joined us here in the Mind of Nature. The topic is the hidden pandemic. This is a pre-recording, but as you can see, Dr. Zarif and I are in the chat and in the comments. So any questions you may have, you can go ahead and drop them in the comments or in the chat, and we will be there to answer them as well. Again, thank you all so much for joining us here today. If you have not already, please subscribe to the YouTube channel. It's Dr. Farid Zarif. We all thank you again so much for being here. And Dr. Zarif, back to you.
Thank you so much, Carolyn. Let's go ahead and keep on pushing ahead. So we want to go ahead here, and we want to talk about some of the global causes of death. So we start off with the when we talk about heart diseases, period, whether they be ischemic or whether they are the different types of heart diseases and valves, or it might have artery problems, or it might have problems with the way that it beats, for instance, the different arrhythmias, so forth. The heart, we have to definitely be very conscious and concerned about heart health. Super important. And you see still the number one cause for death. Next is stroke. Now, stroke is another thing that people get for various reasons. One of the reasons that we can put in stroke is because of the foods that we eat that cause our circulatory system to act in such a way that it becomes life-threatening. Eating the foods that will reduce the chance of stroke, living the lifestyle that reduces the chance of stroke and chronic obstructive pulmonary disease, low respiratory infections, neonatal conditions, trachea, the bronchus, lung cancers, Alzheimer's disease, and other dementias. And then we have diarrhea diseases. And these are some people with these diseases. I've even heard people say, I lost a lot of weight when I got sick. Well, if you can take from where you are when you are sick and start to build up, not to go back like a lot of people do, they start getting better and they go back to where they started and they do the same things that got them sick in the first place. Well, this is nonsensical. This does not make any sense at all. Now, if we want to make sense out of it, we look at habits. Things become habitual, but you don't want those things to threaten your life. And that's what we have come to. And that's why we're here today talking to you about that. Type 2 diabetes is super important also. This is also number 9, is according to 2019, type 2 diabetes. Also kidney diseases. These kidney diseases, as you see now, dialysis is huge now. It used to be just a little dialysis. Now it's huge. It's no big thing. Why? Because the sickness of the kidneys is definitely expanding. More and more people are suffering from diseases of the kidneys. Now, when it comes to some of the causes of disability, these are some of the causes of disability today, and this is according to 2019. Neonatal conditions, ischemic heart disease, is stroke. Now, these are they're positioned differently now because these are some of the diseases that causes disability. So because of these diseases, it can cause other like comorbidities or other diseases that are connected with these diseases. A stroke again, and lower respiratory infections, which we heard so much of it during the pandemic, these lower respiratory infections, diarrhea diseases, road injury. Some of the highest numbers in our death today are caused by car accidents, or it can be other things that getting, the weather, or the other things such as tsunamis and the different tornadoes and floods and things of that nature. Chronic obstructive pulmonary disease, diabetes mellitus, tuberculosis, and congenital and the different diseases, or even some of the deformities that are congenital, those that people are born with. The causes of death by sex is next. So the death and the disability is disaggregated. The calculation is disaggregated by sex. So annually, the global deaths of the DALYs among the women were about 15% lower than men. However, women collectively spent about 20% more years living with disabilities. In the past 2 decades, the greatest increase in female deaths has been Alzheimer's disease and other dementias. This is really huge, because I'm sure that's like, you probably thought it was like breast cancer. You thought it was some kind of other digestive disorder. But the greatest increase in female deaths has been from Alzheimer's disease and other dementias. There are several types of dementias or cognitive diseases with nearly a threefold increase. Now, these neurological disorders kill more females than males, with about 80% more deaths and 70% more DALYs for women than for men. Now, I'm going to just pass a couple of these things because I want to get on to making sure that we stay on time and we really do respect your time. We're going to go ahead and give you some of the things that are important so that you can start moving on these things today. There are 6 in 10 Americans live with at least one chronic disease. 6 in 10. So that is a huge amount. And that 4 that doesn't live with any disease are probably younger people. So this here, when you live long enough, you are most likely going to be challenged with some disease. That's why it is very important to get an examination, to have, regulated health screenings. This is super important. If you are head of a church, or you're on these different teams, or you're on these in these different clubs, this is one of the things you want to do. Add to it is to have the different screenings for your cholesterol, for blood type, for your different cholesterol, all of these things. So their blood pressure, all of these are very important that you know these to maintain a level of health that helps you to enjoy your life. Some of those diseases are like the heart disease and stroke, cancer, or diabetes. Now, these and other chronic diseases are the leading causes of death and disability in America. And they also a leading driver of healthcare cost. So we spend billions every year, and it's so high. We are working. When I say we, the government is working on making some chances that we can change these numbers. But it starts with us in our home. Then it goes to the community. Then it goes to other entities, maybe state or citywide. And then we're talking about the whole world. But you got to start right where you are, right at home. Now, the CDC, which is the Center of Disease Control, their job is to make it easier for all Americans to make healthier choices so that they can enjoy life. Now, we know that the most chronic diseases can be prevented by eating well, by being physically active, avoiding tobacco and excessive drinking, and getting regular health screenings. The CDC National Center for Chronic Disease Prevention and Health Promotion helps people and communities to prevent chronic diseases and promotes health and wellness for everyone. Now, improving the environments to make it easier for people to make healthier choices. What are some of those things? You can write some of these things down or come back and listen to the replay. Listen to it over and over. And don't listen for what doesn't help you. Listen for the things that apply to you. Some people, when I hear them talk about, I heard that, but you said this about that, and then she said that, and he said that about that. Take what you can from what you hear. And what you're hearing are things or different options that you can use to help you be a healthier person. And that's what you should be concentrating on, not the whole cake itself. You know, there might be parts of it that you don't like, the icing, or you don't like the texture, or it's too much foam, or, you know, the what you whipped cream here. I said foam, but the whipped cream that's used, you know what I mean? So listen, take from here what you can, and everything else is something that you're either adding to what you already know, or those things that are absolutely, they're not applicable to you. So let's start off with healthy environments, because they promote your health and support healthy behaviors in community settings such as your schools, your child care programs, and the work sites. Approaching or this approach is that improve the environment, reach more people, and are most cost effective, and are likely more likely than individual approaches to have a lasting effect on population health. Not just your health, but these are things that you can also reach other people with. But remember, again, start where you are, start where you live, start where you start in your environment. Another a point that will help to improve our environment: passing smoke-free air laws. Smoke-free air laws that cover all workplaces, restaurants, bars, and protect non-smokers from exposure to secondhand tobacco smoke. And this can be carcinogenic. And this is why we don't need it. It can be cancer causing. That's what carcinogenic is. So, and many of these foods and behaviors that we're talking about, we want to minimize the possibility of these particular diseases. And the next point is banning flavored cigarettes to make smoking less attractive to youths. So the youth youth, they're children. So they're excited. Flavored cigarettes, they don't think about cancer. They don't think about throat cancer. They don't think about nose cancer. They don't think about stomach cancer. These different cancers that may be caused by these particular habits. Another point would be banning artificial trans fats from the food supply to reduce the risk of heart disease. Now, trans fats, as you know, there's two different types of fat. You have the trans fats, and then you have the kind of fats that we do in ourselves. So they're self-producing trans fats, and we make those. But there is a more dangerous trans fat, and that is the artificial trans fats. And these trans fats are in the different, like canned foods. They can be in the baked goods. They can also be in some of the different types of snacks that we eat. And we need to definitely step away from trans fats. Trans fats are also those fats that are solid at room temperature. Those are those saturated fats that can be used for deep frying, and because of the high heat, they can also produce trans fats. Well, that's what we're talking about now. We want to reduce the risk of heart disease. We want to reduce the risk of obesity, reduce the risk of stroke. This is the way that you do it. Fluoridating community water systems is super important, although people say no, fluoridation is really something that's poison. And keep in mind, those things that are poison are the things that we have too much of. The small amount of fluoridation that you find in the water systems, as of this moment, pose no threat to human life. And that is what's important, is that the amount that is used. Now, think about our system before we criticize it. Our system, our drinking, our water system is fabulous. Look at all the things we use water for, and we continue to drink it with a very, very low, almost just super rare incidence of anyone getting sick from the water that we're drinking, other than those places in United States that are known for dirty water, known for not changing their plumbing system and the circulation of water throughout the city, and they have old things, but a lot of that is changing too. So we can look up about that. Another point, we're getting close to closing now, but I want to finish this. Increasing the prices for unhealthy products. Now, if we increase these prices, they do slow it down some, but the best thing is to not produce or to display these unhealthy products. Which products, as I'm talking about? Tobacco, alcohol, high calorie, low nutrition foods and beverages, and also to reflect the medical and societal cost of their use. So a lot of these things are based off of money, not our health. So this is very important to be aware of. Let's look at these last points. Designing communities to encourage walking and biking. So in your community, those places that you can find that encourage walking paths, places that if you can jog, get on the grass, and some places even have the equipment that is used for physical activity. So this is super important. Another is giving children a chance to learn about physical activity and to be physical active in child care programs in school. We don't want children to be overloaded with these foods and these habits, especially early on, because they will take this behavior and it goes from one generation to another. So we can help them to be healthier by being more aware, learn more about physical activity, learn more about the benefits from the physical activity. And lastly, increasing the access to healthy foods and beverages. So you want to have like those full service groceries and the full service farmers markets. They have, let's make those. It doesn't have to be something that seems to be boring and only just the health nuts eat from, but we want to increase the access of these healthy foods and beverages because we then can help to produce full service. We can also put these in demand, the full service groceries, the farmers markets, the healthier menu items in the restaurants. And now we have more restaurants in the last 6 or 7 years. We have more restaurants now that are serving healthier food and they're being featured. These are foods that people are asking and recommending and requesting. So there you have it. We're almost there now. There's other things that we can talk about. Of course, we can go on and on about this, strengthening our healthcare system to deliver prevention services that keep people well and diagnose diseases early. That's what we need to do. And again, going back to this, is that if you know that you have a disease and you know that you've been diagnosed with a disease, and you feel that you just don't want to do anything more about it, you're just going to get by with it. Let's see if we can change that attitude. And when you change that attitude, you also can help improve the access to health care for populations with little to no access. People are taking your example, providing health insurance coverage of effective clinical prevention services. Because you go to a clinic and instead turn that around. I went there, I found out I had this, I am fighting it. I'm going to do everything I can to make it better. If a person tells you, take perhaps a combination of what is being recommended to you, and that is your medication, and along with healthier foods, along with physical activity, along with adequate rest, along with no to low or low to no stress environments. So all of this is a very important part of you getting healthier. These are some of the references, if you'd like to write those down. The Royal College of Emergency Medicine, how many deaths in England are associated with A&E delays. I also got some really wonderful information from the McCusker et al. And I got this from the articles on increasing in emergency department occupancy. So there's a lot that we expect that you take from what we shared today. And I am very, very happy to say that we got a chance to do these things, and within the time that we want to do these things. So we're getting really, really on point, and it was lovely. Thank you for your questions, and I'll see those at a later time, but we'll answer those. We'll at least reply to those. We don't claim to have the answer to everything, but we would like to entertain those questions so that you'll know that you have been acknowledged, or your question has been acknowledged. What you think, Carolyn? What you think? It was beautiful, wasn't it?
Absolutely great. You know, something that you mentioned when you said banning flavored cigarettes to make it less attractive to youth. I have two coworkers, and they're working on stopping smoking. So what they started doing was vaping. But one of them mentioned that vaping actually makes it, I guess, worse because it's so much more accessible, you know, to them, and it's flavored, you know. So there's a lot of work to be done as far as the education on what to do to make it better for you as far as your health, because you think that some things that they bring out may help, but they're actually making it worse, you know. So that was just something that came to my mind. I'm like, that there's a lot of work still to be done in education.
Absolutely. And we need to know where our children are, who they're spending time with, what are their habits, what about their parents? You know, check out their parents. If their child has been coming over your house and you say, oh, she's so sweet and he's so nice and all that, check out the parents. You know, and I'm speaking of children. You know, these are children. Even if I don't care if they are 17, 18 years old, they're still children. That takes that long for the brain to be completed in development. So that's why we wait until people are 21 years old before we consider them as being adults. Now, we do have some children that are an exception to that, and that's wonderful. But know where your children are. You know, I remember in Detroit, I was growing up, and they said, it's 11 p.m. Where are your children? You know, and they would make this thing, you know, people, let me make sure the baby's in bed and all that stuff. So let's get back to that. So thank you, everybody. Thank you so much, everybody on YouTube channel and everybody that is on. Where else are we on today?
It would be streaming Facebook. On Facebook as well.
Beautiful, beautiful. And spread the news, please. You know, people on other networks, let them know. We're out of here. Go ahead, Carolyn. You want to get to your words of glory in before we get out of here?
Well, you know, I'm always just reminding everyone to subscribe to the YouTube channel. We are here 8 a.m. PST every Saturday, 8 a.m. PST. So thank you all so much for joining us here today. In the Mind of Nature, our mission is to bring awareness, listen to your feedback. And now it's time for you to take action on the information that you heard here today. So thank you all so much for joining us. Dr. Zarif, do you have any last words?
Peace and love, everybody. Thank you so much. See you next